Case Western Reserve University School of Medicine in Cleveland, Ohio. This is the All Access Med School Admissions Podcast. Hello again, everybody. I'm your host, Christian Essman, and I'm the Senior Director of Admissions and Financial Aid here at the medical school. And it is great to be with you again today, so thank you so much for listening. A couple months ago, I was able to travel to Nashville for the AAMC's national conference, and not only did I get to meet some new admissions people and reconnect with some old ones, but I also had the pleasure of meeting some of my listeners, which is just so heartwarming, and frankly, it's quite flattering. So I really do appreciate that you take the time to listen to my show. I'll tell you, given the success of the show, thanks to you, this year I'm going to try and work on making more time in my schedule to bring more content to my podcast. So fingers crossed that we can find that balance. So we'll see, but that's the plan. One of the new admissions people that I met when I was in Nashville was my guest today, Dr. Dustin Fulton. And not only was he excited to be a part of this project, but I have to credit him for introducing me to a really cool app for your phone called Blink, B-L-I-N-Q, which is essentially a digital business card. So as we were talking, we came to the point of our conversation where we wanted to exchange information. I reached for my good old-fashioned business card, and he whipped out his phone and showed me this app, and it's so cool. All you have to do is have the other person scan a QR code, and then bang, all their contact information is in your phone, and you can customize it and include like links to websites you might want to point people to, or social media sites, or other things like your LinkedIn profile. So it's brilliant, man. It's just brilliant. So I'll put a link in the show notes, the show descriptions, so that I thought you might find this to be a helpful tool too, and the stuff that you do and people that you meet. So there you go. So we're here today to hear and learn about the medical school at the University of Tennessee. So let me begin by giving you some background on this institution. Founded in 1911, the College of Medicine is one of 6 colleges that comprise the University of Tennessee Health Science Center, or UTHSC. While the main undergraduate campus is located in Knoxville, the medical college's statewide programs are located on 4 locations in Memphis, Knoxville, Nashville, and Chattanooga, as well as some other smaller sites across the state of Tennessee. UTHSC is situated in one of the largest medical centers in the nation in downtown Memphis, and the city of Memphis is located along the Mississippi River and is known for its rich musical heritage and its impact on blues and rock and roll and jazz. And they're also known for one of my other favorite things besides music, and that is barbecue. So UTHSC is also one of 2 public allopathic medical schools in the state of Tennessee. And the mission of the University of Tennessee Health Science Center is to improve the health and well-being of Tennesseans and the global community by fostering integrative, collaborative, and inclusive education, research, scientific discovery, clinical care, and public service. The College of Medicine aims to improve the health of Tennesseans and our society as a whole by providing an exceptional and nurturing environment for the education of students and physicians, by contributing to advances in medical science, and by providing health services of the highest quality. The college has a strong commitment to training physicians who plan to go into primary care practice. Throughout the 4-year curriculum, students are exposed to primary care options through preceptors and master clinicians in the first 2 years, and during clerkships, electives, and junior internships in the clinical phase of the curriculum. The accelerated 3-year curriculum, which Dr. Fulton and I discuss, offers a conditional acceptance into a primary care residency program at UTHSC upon the completion of the MD degree. The medical students from the College of Medicine spend their first 2 years on the Memphis campus and then rotate on all 3 campuses for clinical training, including Memphis, Knoxville, and Chattanooga. The College of Medicine gives priority for admission to applicants from the state of Tennessee. That said, applicants from any state may apply and will be considered for admission, but priority will be given to Tennessee residents. A small number, about 10% of the class, are applicants that are from out of state and those that are admitted. Applicants must be citizens or permanent residents of the United States at the time of the application as well. This year, they received around 2,600 applications, and they will interview approximately 400 for a class of 170. They also have an MD, PhD program as well. Now, let me tell you a little about the man from Tennessee. That's reference to a lyric in a beautiful old song by Dave Loggins called Please Come to Boston. Check it out. Okay, Christian, stay on track. Okay, the man from Tennessee is Dustin Fulton, who serves as Assistant Dean of Admissions in the College of Medicine at the University of Tennessee Health Science Center. He also maintains an adjunct assistant professor faculty appointment in the Department of Medical Education. He is a champion of equity, and research interests include medical school admissions for groups historically excluded. Dr. Fulton has a bachelor's degree in business administration from the University of Tennessee, Knoxville. He earned a master's degree in leadership and public policies with a concentration in student personnel and a doctorate in higher education administration, both from the University of Memphis. In his free time, Dr. Fulton enjoys spending time with friends and family and cycling. So, all right, let's jump right into it with my conversation with Dr. Fulton. Enjoy. Hi, Dr. Fulton. It's great to have you. Thank you so much for joining me today.
Thank you so much for this opportunity, and please feel free to call me Dustin.
Okay. All right. Well, thank you so much, Dustin. Hey, we met about a month ago in Nashville, and I saw you and I said, hey, you got to come on my podcast. And
yes.
A month has gone by. We were able to pull this together. So I truly am very grateful that you've been so kind in joining me. So I'm anxious to get this info out to the listeners about your school.
I'm equally grateful for the opportunity to share information about the University of Tennessee Health Science Center. So thank you.
Oh, yeah. Well, before we get into all the stuff about University of Tennessee, you've been there for a while. You're kind of a product of some of the different institutions around there. So what do you like about this, Memphis and the areas around there?
Memphis is home for me. I'm actually from Memphis originally. Went off to UT Knoxville for undergrad and returned to do advanced education here at the University of Memphis. So I'm alum with both the University of Memphis and UT Knoxville. But Memphis is just an incredibly diverse city. It's one that I've really been intentional about returning my talents to the city where I'm from. So, yeah, I've been here at the Health Science Center now for going on a decade.
Wow.
And I've worked through a number of different offices and positions here. But it provides our students, an opportunity as well to experience the diversity and the culture here as well.
Yeah, that's great. What do you do for fun around there?
So during the pandemic, I actually got into road cycling. Something that I didn't think I would ever get into, but when all the gyms closed, there was nothing to do. And I'd been saying for a few years I was going to buy a bike because I live near the Green Line here in Memphis, which is another huge attraction. And I finally did it. At the time, all the bikes were flying off the shelves. So
how'd you get one?
Put myself on a list and got one, several months later. But yeah, so I've been able to experience Memphis in a different way now. There are things, ordinarily driving in a car you don't see or observe about certain parts of town. And it's just, it's an amazing way to also kind of stay active. So I've thoroughly enjoyed it and have been able to connect with students too who share a passion for cycling.
Oh, that's cool. What's something people are surprised to learn about you?
I would say how much I've accomplished in what I would consider, a short time, professional journey, especially here within the institution. So it's often one of those things where people ask me, wait a minute, you've done this or you've done that? And I'm like, yes. So I'm very thankful for the opportunities that I've had for advancement professionally within the University of Tennessee system.
Mm-hmm. Yeah, I was surprised. That's a good one because when I read your bio, I was like, geez, Al, like you're probably 28 years old.
Yeah, right. I would love to think so. I really love that. We'll go with that. Yeah, I like that.
Oh, that's awesome. So let's get into let's talk a little bit first about some of the curricular highlights of your medical school. And there are some unique features that come with your school. what are some of the things that you like people to know about your school or prospective applicants when they're first kind of scratching the surface of University of Tennessee? What are those things you'd like them to kind of key in on?
Yeah, I'll start with one that I would consider to be a hot topic right now in medical education. We just recently went to a pass-fail grading system. Mm-hmm. So after step one went pass-fail, we made that decision. But ultimately, it's something that our committees within medical education have been considering for some time. So the timing of it just happened to be after that initial change with that exam. What I think is really unique about UT and College of Medicine here is that we provide students with a lot of resources for success, both academic and personal resources. And we want to ensure, wellness is something that our students, keep front of mind as they go through a very rigorous, curriculum. And we emphasize that both within the curriculum through more formal opportunities for students, but also, doing things like having 2 personal wellness days built into each semester, no questions asked. That's both the preclinical
they could just
clinical.
Say, I'm today taking a vacation day, a wellness day today.
Yes,
and
that's it, and we don't ask questions. We want our students to really, we want to model that too, for our students, that it's okay to sometimes need to step away from everything to make sure that they are well personally. I think in our preclinical curriculum, we have some things that are pretty unique. We still do full dissection in the anatomy lab. So we have been very fortunate through our donor program of cadavers to be able to allow students in groups to do full dissection. So, I know whereas some institutions may sort of have, groups that may do one part of the body and others come in to examine it. Each group will have access to an individual cadaver that they are able to do full dissection on. And our students find that very helpful. And to make sure our students are learning, as our lectures go along in a semester, the anatomy curriculum also follow that style. So they're pretty much in class learning about, different parts of the body, and then they're going into lab that afternoon or the next day and seeing it. And then on the weekends, we still run a full anatomy tutoring lab. So Saturday mornings, our students are able to come, and with students who are 3rd or 4th year medical students, perhaps, who did really, really well in anatomy, they have an opportunity to work and serve as an anatomy tutor to students who are going through it currently. So we also have lecture tutoring as well. And this is really cool because several years ago, it actually came with a cost. And when we hired a new executive dean of the College of Medicine, that was one of our students' chief complaints. It's not fair. And our executive dean said, you know what, you're right. It's not fair that, for those who can't afford tutoring that's provided by the institution, they get it. And for those who can't, they don't get it. So tutoring here is at no expense to the students. And we also stress to prospective students that tutoring looks very different here at UTHSC. It is more supplemental instruction. Greater than 90% of our students are going to participate in tutoring. It's because it's an additional opportunity to make sure that you are really digesting, the things from the curriculum that you should be. So the majority of our students take advantage of those opportunities.
It sounds like even if you just went and did it a few times, just to kind of make sure you're capturing the information that's coming at you at high volume, light speed.
Yes. Yeah. Many of our students will even do the pop-ins like, hey, didn't need it this week, but next week I'm definitely going.
Right.
So they have that ability through the resources that we provide to do that.
Sounds like a lot of great academic and wellness resources you guys have implemented or kind of enhanced just in the last few years here too. Yeah.
We've done that. We've been very intentional about fine tuning, how we prioritize wellness for our students and as well as student success overall.
Yep. That's the hot topic these days. I feel like on interview days and as students are shopping for different medical schools, asking those questions about what wellness resources and opportunities do you provide your students. There's a special program that I saw, and we talked a little bit before we hit the record button about the 3-year accelerated MD. Which is a bit unique. And I'd love for you to share with the people listening a little bit more about that, because it's something, it's interesting.
Yeah, this is a big one, and it's fairly new. I think that our first cohort, those students are in their second year now.
So it's really new.
Yeah, it's really new. We have not graduated the first class. That won't come until 2024. However, this is a program that is designed for students who know without a doubt they want to go into one of the primary care areas. So pediatrics, medicine, pediatrics, internal medicine, family medicine, psychiatry, or obstetrics, gynecology. Those are the areas. We're really excited to kind of announce, and I guess publicly here now, that we've added neurology.
I saw that on that list. So I was like, whoa.
Now we have a new one. We just updated the website less than a week ago. So it's
hot off the web.
New. It is. But the goal with this program, it's really two different things. One, it gives us an opportunity to really address a shortage of primary care physicians in the state of Tennessee. So an accelerated program allows students to graduate sooner so that we are addressing the need sooner without sacrificing the important elements of the curriculum. It's one thing to note. 2, students are able to take advantage of some cost savings, right? So it reduces the burden of the cost of medical education a little bit. You save essentially 25% because you are completing medical school in 3 years versus 4. But the other side of that is you're also entering the workforce a year sooner, so you're earning a year earlier than counterparts in the regular 4-year MD program. These are the way the program was designed is that these are residency positions that students are able to get as soon as they are interviewed for admission. So everybody starts through the regular admissions process. Once accepted, every student who applies to UTHSC College of Medicine has an opportunity to apply separately to the 3-year track.
Okay.
So then, if invited for an interview, you would interview with our 3-year MD curriculum committee, as well as the program director of that residency or specialty, rather, that you are interested in, or their surrogate. So it allows you to have that what would typically be your interview for residency immediately following your acceptance to medical school.
Wow.
So then these students don't need to take time off to interview for residency. So there's one way we take advantage of saving some time in the curriculum. Normally there's a spot built in the first summer after the first year. Our students would take that to either be on vacation or many of our students will do research. There's part of the curriculum that's built in there for our students to be able to sort of advance through the curriculum. So fortunately, you lose the summer after your first year of medical school, but all the rest of the breaks are still the same. The other difference is normally we would require our students to take and pass step 1 before starting the clinical curriculum. Students in the 3-year MD program are able to start the clinical curriculum actually before passing step 1.
Oh, no kidding.
They will just simply have to take that test within the first 6 months of that clinical curriculum.
Is there dedicated time they could step away from the clinical rotations to study and take and pass?
Yeah, they get the same time as other students, for dedicated study time. So it really is a great program for students who know coming in that they want to go into one of those specialties. The other huge benefit to it is that there's a second entry point for the program. Let's just be honest. There are some students that are like, hey, I want to get to medical school and know that I can do it, right?
Yeah.
And so we understand that. And so at the end of the first semester of medical school, there's another solicitation of students, who might say, all right, got one semester down. So leading into the second semester, they'll have an opportunity to apply for the program because, of course, it's ahead of that first summer. So there's still an opportunity for them to jump on board. The benefit is that students in this program really have an opportunity for some additional mentorship beyond what everybody is provided as a student in the College of Medicine, but they are closer in proximity to residents in that specialty because they're introduced earlier. So they get a chance to really have some more advanced mentorship opportunities through their specialty.
Wow. Okay, I have a couple questions here. One would be, how big has been the cohort of students that are in the 3-year MD? A lot, or because you have a class of about 170, right?
And so the 3-year MD program is incremental to our 170 seats. So it's been pretty small. We won't typically admit more than 8 to 10 students per cohort.
Okay.
The first cohort was 6 students. I think the second one was 8 students. And then you add in the people who will apply in their second semester of medical school. So it never exceeds 10 people typically in that program.
The one thing I think that we haven't emphasized, or that I think needs to be, make sure we really highlight though, is they're guaranteed a residency, right? At Tennessee after that third year.
Yeah. So all students in the 3-year MD program have a direct pathway into a residency program here at UTHSC in their chosen specialty. And then there's family medicine, which also has an option of completing that residency in Jackson, Tennessee, a more rural area in West Tennessee, should they elect to do so. But every other specialty, they would have a direct pathway into a residency spot here in Memphis,
which is a big deal. That's a big deal when it comes to when students are applying to residency programs. That if they make this commitment and they're committed to staying in Tennessee, and then to do their residency there, that's a big load off your shoulders.
Absolutely, and our students really love that. The ones that we've talked to who've applied. Why did you decide to do this? Well, I knew I wanted to do primary care, and 2, I don't have to think about residency, going into my final year. I know where I will be. Yeah. And then on the other side, we get the students say, well, what if I get in this advanced curriculum and I don't think I'm going to do well? There is equally a pathway back into the 4-year program.
Okay. So there's an off-ramp. Yeah.
Yeah. So and then we also understand that, you may go to med school and you may meet the love of your life, and you may decide that you want to do a couples match. And of course, you would need to be in the 4-year program to do that. So we allow, an off-ramp so the students can get back to the 4-year program with no questions asked.
3-year MD accelerated cohort, they do the first year with everybody else.
Yes.
With everybody else in their first year class.
The first year and a half is about the same. We do invite the 3-year cohort on campus a little bit sooner before their counterparts will start, just so they could have basically a 2-week orientation into what the program is, get them acquainted with their colleagues who are already, residents, or the program directors in those programs as well.
One more kind of really nerdy question, but what about if, let's say, okay, there's 6 people or 8 people that are interested or brought into the program. What if, can all 8 of them say, like, we all want to do pediatrics, or do they try to spread it out amongst the different primary care specialties?
That's a good question, and it's one that fortunately we haven't been up against yet. Yeah. But when we originally rolled this program out, we did have an agreement with the different specialties on the number of students that they would take. So there wouldn't be the flexibility for everyone to do one specialty, unfortunately. However, the programs that are participating have carved out a certain number of spots for this particular program.
Okay. All right. So there's got to be a little bit of a mixture there.
Yes.
Okay.
Yes.
Yeah, it makes sense though. Well, like it sounds like a wonderful program, and it's still getting off the ground, but
Yes.
it's very innovative approach to trying to meet that need quicker. So it sounds like you're trying to get more physicians into the state of Tennessee faster. What other kind of opportunities are there for all the students to get involved in, in the community of Memphis and in that area? What kind of things are they involved in?
Our students have really good community engagement. I have to say it, from things such as a weekly clinic that we call Clinica Esperanza, which focuses on the Spanish-speaking population here in Memphis. It's a clinic where it's led by an attending, but our students have the opportunity to volunteer. They don't have to speak Spanish to volunteer. There are translators who also volunteer. But it's an opportunity for them to work with a different patient population here in Memphis. And it's something that many of them jump at the opportunity to, so much so that, you have to really, as soon as it comes out that a new opportunity is available through Clinica, you got to jump on it or it will fill up. Our students also do unique things like Memphis Street Health, where understanding the needs of the homeless population in Memphis, making sure that they can provide, services, of course, under the guidance of an attending to the homeless population in Memphis through exams of their feet, understand that's their mode of transportation, but also making sure that they have fresh socks that they can put on. So that's something that they come together and they'll do. So those are two examples of how our students are involved in the community. I think a third one is called Health Students Teaching Memphis Youth, where they go into elementary and middle schools in Memphis to make sure that they can teach, basic information about what it means to be healthy, especially as it relates to diets or, other areas. So they're really involved here in Memphis. We love it. We love seeing our students be part of the community. I think it's more than just being here in the community, but I think we have to show ourselves friendly, to the community, that we get an opportunity to serve here locally. And that continues. There are other activities throughout the state of Tennessee as a statewide institution where our students will also be part of, because many of our students will elect to do rotations in Jackson, Nashville, Knoxville, and Chattanooga as well.
Yeah, well, I want to talk about that in just a second. But what I wanted to ask you, first, we're talking about community. We talked about here students being involved in the community in the Memphis area, and touched a little bit on some of the support that's within the institution. What about students that come from affinity groups that are, say, underrepresented in medicine or LGBTQ or first gen? What kind of support resources or community can they feel at your school?
Yeah. So one of the things that we were really proud of was to hire the inaugural Associate Dean for Diversity in the College of Medicine about 2 years ago. Something that our students advocated for, and the administration was very responsive to. But there are opportunities for our students to find a home somewhere within the college. There are so many opportunities. One, if you're part of the LGBTQ community, there's Unite. So it's an interdisciplinary group as well. So it's not just College of Medicine students. You have an opportunity to connect with students from, let's say, pharmacy or nursing or dentistry, who might also be part of that group. There's SNMA, which is huge, for our students. We did something recently. So the Bluff City Medical Society is a chapter of the National Medical Association, and they have a really strong physician base here in Memphis. And so we entered into a partnership with Bluff City to make sure that our students who are underrepresented in medicine by virtue of race and or ethnicity have an opportunity for some additional mentorship from community physicians, right? So not only those that they get a chance to see here within the college and throughout the hospitals that might also work alongside our faculty here, but they get a chance to connect with somebody maybe in their specialty or outside of their specialty who is typically a Black physician in the city, where they can have some additional support. I always say that's really important, because sometimes the people who are really close to the academics, our students might not always feel comfortable asking certain questions. It's also important as we produce a large number of physicians, in the state of Tennessee, to make sure that they have a way to connect with local physicians to see what it's like to practice medicine in this community.
Right.
So there are two projects within that program. One is for residents and one is for students. And
cool.
Love City Medical Society has been a huge supporter of that initiative. It also came with great support from our executive dean, the College of Medicine, as well as our executive vice chancellor and COO for the institution, Dr. Ken Brown.
So a lot of people came together to make this, let people know we are all on board.
Yes.
That's wonderful. You mentioned a couple minutes ago about how your students get out and do other clinical activities outside of Memphis.
Oh, yes.
And from the homework I did, it sounds like in the preclinical years, the first 2 years, they're doing their early clinical training in Memphis. But then third and fourth year come and they can do their rotations in Chattanooga, Knoxville, and Nashville
And Jackson. Tennessee.
Okay.
Yeah, so family medicine is available in Jackson.
So how does that work?
Yeah, good question. One of the reasons that's important to us is because we understand that as students move across the state, they're going to experience different patient populations, which is what we want our students to be able to do, so that they understand working with different patient populations. So we do require the first 2 years, all our students are here in Memphis, as you noted. And then from there, we require all students to do what we call an East rotation. So you have to do at least one of your rotations in Nashville, Chattanooga, or Knoxville. However, some of our students elect to do all of their rotations in those areas. So all the rotations are available in Memphis, Knoxville, and Chattanooga. So an East-only student might be in Chattanooga or Knoxville or spend their time going between those places. And for everyone else, they're going to at least do one rotation in those cities. So what we do is we provide housing. The College of Medicine provides housing. So we have agreements with apartment complexes where we lease that space for our students to be able to rotate. So it changes. And we have phenomenal coordinators who are able to make sure that everyone has housing. Now, of course, if you decide you're going to do all of your rotations in Knoxville or Chattanooga, then you would have to provide your housing. So the college provides up to 6 months of housing within that clinical curriculum if you have some of your rotations be in Nashville, Jackson, Chattanooga, or Knoxville. And then for family medicine, Jackson, Tennessee is very close to Memphis, so we provide housing during the week. Our students return on the weekend. And then they'll go back.
So this is then, I have to believe then this kind of, when it comes down to the dollars and cents, this kind of stuff is built into the financial aid. Cause I'm sure students were, how do I pay for, doing these kind of outside of the city of Memphis kind of stuff?
Yes. And our students don't have to worry about that aspect of it. It's all built into how we kind of establish the tuition and fees.
Well, you mentioned a little bit ago about students getting involved in research. And that's usually another hot topic amongst students that are doing their shopping. How do they get, if they want to do research, one, is it required? And two, how do they get involved in it?
So we have something called Longitudinal Scholars Project, or LSP. So research is required for all of our students. But we have a director of student research who sits in the Office of Student Affairs, who is the liaison between our students and research opportunities. We also have mentor groups that we call empower groups, where our students have both peer and faculty mentors. And a lot of times the faculty mentors are able to connect students with research projects that they might be interested in. So for the LSP, the requirement is that you do a project. It's longitudinal over all 4 years. So you can choose when you want to complete the project. And the culminating event is typically a graded poster presentation in some form that's approved by the Office of Medical Education, where faculty are able to observe and evaluate the project as well. But the topics are community or global health, patient safety or quality improvement, or just health-related research. So very broad. So whatever your research interest might be, you're able to do that, within that LSP project. Be honest with you, some of our students, there's time built into the curriculum every semester to complete modules that we also think are important in understanding what research is. But some of our students will wait to their final year to sort of complete the project, which is completely fine. So long as they're making some progress, so it's completing the prerequisite modules ahead of schedule.
Okay, yeah.
The other thing that is fairly new is our executive dean worked with the chairpersons for each department in the College of Medicine to identify what we're calling research coordinators, so that if there is a particular topic that lives within one of those departments, there is, even beyond the director of research that sits in student affairs, a research coordinator for that academic department, where students can be in touch with to learn of opportunities for them to be connected.
Okay, so that's cool. So there's like a liaison, let's say, to the Department of Orthopedics, and somebody's really interested in orthopedics. That's it. And they can say, okay, go talk to them and let's see what they have going on maybe in their department as far as orthopedic research that you might be able to, get in on.
And that way we're able to formalize, the support versus it only being through a mentorship opportunity.
Yeah. Okay. Great. Well, that's cool. I didn't realize it was required and everybody has to do it. But it's across all 4 years. You mentioned global health. Are there opportunities for students to do things internationally?
Yes. There's a new initiative too, where students have an opportunity. We just sent the first 2 students to medical school in Israel, where we'll be receiving 2 medical students from there who will spend time here learning within our college as well. Fairly new, but there are also other opportunities for students to become involved with global health initiatives as well. One of the assistant deans in student affairs, Dr. Nia Zalamea, also has some initiatives, and she works as part of the Global Surgery Institute to help connect students with opportunities.
Great. We've kind of touched on highlights, little bits of everything. Dustin, is there anything we haven't kind of touched on that you want to make sure we get across to people?
I would really like to highlight a service that we have here called SASE, or Student Academic Support Services and Inclusion. Talked a little bit about the academic support. This is mostly done through SASE. This is an office that is dedicated to student success. So on one side of SASE, you have academic and learning support resources. This is the tutoring program that we discuss is run through this office, both for lectures and labs. It's also where you'll find educational specialists that will sit down with students to help them develop a plan. They'll help guide them through assessments to figure out how they learn best, so that they can make sure that they are studying, a way that is helpful to them individually. They'll also sit down with them around dedicated study time for STEP and come up with a plan. Say, hey, here's how you can attack this, and this based on how you learn, this is something that will work. And they're able to make appointments to readjust things as often as they need. So they're also learning resources through a library, test prep, study materials that can be checked out from SASE. And some of these resources are also available through our library as well. And the educational specialists in SASE will help navigate students through that process. On the other side of SASE is counseling services. This is where we have a dedicated staff of counselors to provide mental health counseling to students at no cost to them. So several years ago, as an institution, we realized as support and resources increase at the undergraduate level, we have to be ready to meet those needs of students as they come to us. So we fully built out counseling services, which is led by Dr. Kimberly Williams Collins. And there are about 5 full-time counselors, as well as a dedicated counselor for GME for our residents and fellows.
Oh, wow.
And additionally, there are interns from the counseling psychology program from a local institution here in Memphis who will work with us as they complete their practicum. So our students can make these appointments at no cost to them. And even through our university health services, students are able to make appointments for counseling if they would prefer to do it that way. But SASE is a true gem for us. It is something that is huge. Our leaders in SASE have also been invited, by other medical schools to kind of share how they establish this resource, but also how it works for our students across many disciplines here.
Yeah, I mean that's really having that educational support as a medical student is really important, because I frequently, when I'm talking to prospective medical students, and this is why you guys have this too. I'm sure we'll agree here. Like when you come from college or grad school to now med school, professional school, you're going to have to maybe adapt your learning styles a little bit again, and maybe kind of remember the way you went from high school to college and the way you realized the way you studied as a high school student not working. You have to kind of adapt and adjust as a new college student to how you need to study as a college student. So that same transition may happen again. And so to have these people here, those resources, say, let's sit down. Like, is that time management, or let's make sure, because I think sometimes students want to make sure, am I doing this right?
Right. And then there's all the information that you get from other students, who are your senior, who tell you, do it this way or do it that way. And you really need to focus on a plan that's going to work for you individually. I ran into a student just before the Thanksgiving break, and this is a first semester medical student. And I said, how are things going? And she told me, she says, well, I figured out that what I was doing in college really wasn't studying. And I said, well, what do you mean? She's like, I had to change everything about what I thought studying was, but it's really been helpful. And I said, now do you understand why we actually require all first year students within about a month or so of joining the class and starting school here to meet with an ed specialist in SASE? And she said the same thing that many of our students will tell us, is that she goes, I love SASE. She was like, I spent a lot of time there. And we're like, good, because it's a huge benefit to our students to have that resource.
It's a unique one to the amount of resources that you've assembled for that. I haven't seen, or at least people haven't told me about it at other med schools. So
another area of that, the I in SASE for inclusion is because also there is a disability specialist in SASE. So if we have students who have a need for an accommodation, they can work through SASE to have their needs met with that accommodation. So all of that is housed, together to provide the best benefit to our students.
Yeah, it's wonderful. It's wonderful. And so I guess, to people that are listening, wherever you end up in medical school, you seek out these kind of resources, because it can be helpful. And it's not about identifying necessarily learning differences, but to sit down with somebody who knows how your curriculum works, who's seen other students be successful, and how people have kind of had to tweak things and fine tune, because these are all high achieving students. I mean, nobody accidentally gets into med school.
That's it. That is it. And they have a relationship with the faculty. They've seen it before.
Right.
They know what's coming, and can really assist.
Yep. Oh, that's wonderful. Lastly, before we kind of switch gears and talk about the admissions piece, you just mentioned that you heard from students that they really like SASE. I was going to ask you, what do you hear from students, just kind of, bumping into students that you hear that they comment that they like maybe the most, or one of the things that they enjoy the most about your school or their time there?
SASE, let me think. It may be, there are a couple of things. One is the learning that students get through CHIPS. So CHIPS, or the Center for Healthcare Improvement in Patient Simulation, so we call it CHIPS for short, is a state-of-the-art simulation building that we have here. This was opened in 2018. It's 45,000 square feet, and it provides students to learn in such an advanced simulation setting that by the time they make it to their rotations in the clinical curriculum, one of the things that we hear from residents who are working with them is that UTHSC students are really prepared. We take time through a course called the Principles of Clinical Medicine, or as our students have kind of named it, the How to Be a Doctor course. And PCM is built into the curriculum throughout all of the preclinical and clinical curriculum. But it really teaches students things like how to communicate, bedside manner. As early as the first semester of medical school, students are in ultrasound lab, which, for a lot of institutions, that might not happen until the clinical curriculum.
Mm-hmm.
So all this happens through CHIPS. We also have standardized patient encounters through CHIPS, where paid actors and actresses come in to really play out these scenarios so that our students can have some hands-on experience even before reaching that clinical curriculum. And we really find that it helps them, when they get bedside with real patients, because they have the ability to communicate. They've seen things. They know how to do a lot more than perhaps students from other institutions. And so our residents are very complimentary, as well as our attendings of our students having been able to experience CHIPS. And CHIPS is very unique. There are only, from what I understand, a handful of facilities to this extent in the country right now. So you can think of things like a surgery center within CHIPS, a pharmacy within CHIPS. There's a home environment within CHIPS. There are several patient exam rooms in CHIPS and debriefing rooms. So our students have an opportunity to learn through practicing with these mannequin patient dummies, real things that they've made with patients. And we'd like to think these mannequin patient dummies are so advanced that they can do much of what the human body can do, so I'll spare you the details, but it's a lot that can happen with these mannequin patient dummies. And even in the surgery center, there is a room and the ability for students to be able to actually push drugs to one of the trainers so that they can actually respond and react as if it was a true case. So CHIPS is a huge benefit to students as well. So beyond SASE, I'd say CHIPS is the other thing. Third thing I'll mention is the collaborative environment that we have here. Our students are so supportive of each other. And many times on interview day, I'll kind of plug this, and it's not until students get here they're like, "Oh, this is for real."
Yeah,
and it's not dog eat dog. It's more so we all want to be the best physician that we can be. How do we help each other get there? And so our students will share resources that are helpful. You'll oftentimes see students say, "Hey, I found this resource and it helped me on this particular exam, and I'm just sharing it." Some of our students will pass down resources that they found helpful in studying for an exam or for STEP. And even with the clinical rotations, based on the lottery system, if you get a rotation that you might not like, or, you want to trade out, our students create this huge Google Doc where they say, "Hey, I have a rotation here," and they'll switch out. And our medical education team is really supportive of this and will allow students to swap those rotations. But all of it is initiated by the students. They do this and we just support them.
Yeah. Oh, great. Oh, good. I'm glad I asked that. Okay, you got us juiced on University of Tennessee. Let's switch to the admissions things and get into that part of it. So, you guys, what'd you get last? Like 4,000 applications, something like that?
We saw at the height of the pandemic a huge increase in applications, and our guess is that it will get back down to where it typically was. We've seen some some decreased applications in the last 2 cycles. But this past year, we received, I guess the current year, we received a little bit over 2,600 applications, again, for 170 seats in our class. So we're inching back down to the numbers. Pre-pandemic, we received about 2,000 applications. We got up to a little bit over 3,000. So during the year where nationally there was about an 18% increase in applications across all U.S. medical schools, we saw a 48% increase in applications. Oh, yeah.
That was a fun year, wasn't it? So when you're the question that we get all the time, and we're standing at our booths. We were across from each other back in Nashville, and I'm sure you got the same kind of questions we did. And then the pre-med applicant walks up and says, "So what are you looking for?" Like what? So let me ask you, Dustin, and I know that's one of the hardest questions to answer. But what are perhaps some of those experiences or characteristics or values or attributes that you feel like your committee or your school has put some weight into or value on?
Yeah. So, beyond just being prepared academically, we think it's really important for our students to be really good at communication, right? As you talk with patients, it's important that you have really good communication skills. It's something that we also take time within the curriculum, especially PCM, to help students with. But coming in, we know that there's just a level that students have to be at, so that we can ensure that they're going to be great physicians. We also think honesty, integrity, empathy are huge. So as we are interviewing students, we always say that interview is where we like for students to have a strong motivation for medicine and a desire in pursuing a career in medicine, that we utilize that interview to really get a good gauge on what your motivation for medicine might be. We want students to come to us wanting to help others, wanting to serve others. And there are experiences that students can have before reaching medical school that will really sort of hone, their skills related to communication and empathy. But then there are things that students must seek out, such as community service, volunteerism, leadership, that we think will equally help them be the best physician that they can be. And I always say, you want a strong record of leadership. Applying to UTHSC.
What does that look like to you? Because that's one of those. Because for some students, they think, okay, I've got to go become the president of the student organization or student body. But what does leadership look like to you, or what would be some examples that you value?
That's a good one, and we do take calls about this sometimes. People are interested in what our take on it is. But we have a lot of students who were student athletes in undergrad. And we think that's a huge opportunity for leadership, because you're really learning how to be part of a team, but also, how to lead that team and maintain, healthy followership as well. So that's one example that I think students can have. In terms of going out to be the president or vice president of organizations, I think that it's quality of the organization versus the quantity or the number that you go seek out. We want to make sure that there's an impact associated with that leadership opportunity. So it's not just assuming the role to add it to your resume, but it's assuming the role to really make a change and a difference, and being able to adequately communicate that to us, what your impact in that role was. Beyond that, there are opportunities for leadership in civic engagement, and social justice opportunities. It's a lot of room for our students to demonstrate, leadership skills, especially in their primary and secondary application. But those are just a few that come to mind.
Yeah. Yeah. Oh, thank you for letting me interrupt you, because that one we hear it often, and I think I want to help listeners kind of know that it doesn't always mean president, behind your name. It can be other things where you're demonstrating leadership skills and
yes. And sometimes it's the work that you do within a committee, within an organization, as long as you're able to articulate what your role was and what the impact was through your work. I think, that qualifies as leadership.
One of the things that I saw on your website that you that I don't see very often, but that you explicitly come out on your website and say, we value medically related experiences.
Yes.
And that I don't see that very often on just a med school's website. Yeah. And so I love it because you're just telling students exactly what they want. Like, we value this. Like, we want you to do that.
Yeah. Well, and it's one of the things that more recently, I think the pandemic, showed us this a little bit as well. But if you think about shadowing versus, other medically related opportunities, shadowing gets you this bird's eye view of the practice of medicine. You can't touch, you can just only follow. We're actually taking on those medically related opportunities, in some other capacity as a scribe, a CNA, patient care tech, what have you, makes you responsible for that encounter with a patient, for writing that note for a physician. And we have found that students who come to us with medically related experience are able to communicate better. Not only when they are in there with a standardized patient, but also bedside. We also found that, it really helps the maturity of our students as they come to us, because they've had to actually work a job most times, right?
Yeah, right.
Which adds this real life experience to it beyond what they get from the actual interactions with patients or working with on a healthcare team. But it just makes them more mature when they ultimately matriculate to medical school. And then the skills that they develop as part of those experiences are just top tier. We have one of our faculty members who just really loves the students who come to us having been a CNA, right? Because that's a tough job.
It's grunt work.
We value, someone who has taken on that work to get, that experience.
Do you guys have like kind of a threshold of hours? That's usually a common question that we get. Like, is there a certain number of hours, or is it quality over quantity?
It really is quality over quantity for us. And one of the reasons I'll say that too is because we also know that with shadowing opportunities, right? Not everyone is able to pick up the phone and call someone and say, hey, I need shadowing hours. How do I get in with you? So through an equity lens too, we want to make sure that we really take on a holistic approach to evaluating candidates. And that's why it's more so the quality of the experiences versus the quantity, in terms of number of hours that we require, because we just don't, we get that question all the time, what's the minimum number of hours that I need? And I think a lot of times people don't believe us when we say, there's no minimum that we have.
Yeah.
Holistically, we just want to make sure that the students that we ultimately invite for an interview have experience in those areas.
Let me give you some quick hits here on some admissions questions. You mentioned research is something everybody has to do at your school. How about, do you require research as a part of the application process? What if people don't have research?
We think it's important to have some research, on your application. I always tell people you really have to do your homework with the type of institution that you're applying to. Because for us, we teach students how to do research over the course of their time with us through the LSP. But we would like for our students to come to us having conducted some research or been a part of some research project. The goal here, again, is to be able to articulate what your role was in that research project, and for us to better understand what you learned from that research project. Many of our faculty members who serve on the admissions committee will be interested in just hearing, how they can help you. So many of our students will continue their research interests here, And it's important for us to hear from applicants what their role was and, their individual impact, for that project versus, I've completed, 3,000 hours of research and have a published paper. It's more so, can you tell me, what research is, what you've done related to, research and, what were the intended outcomes or, have any goals of the research project been realized? So that's what our faculty are most interested in learning through their questions around a student's research.
So to be clear, you're not looking for publications.
No.
Okay. So, because sometimes that's where people go immediately when you say, okay, well, I didn't get published yet, or, it's like, well, relax. We're not expecting that.
No, definitely not expecting that. Always a plus, right?
Right. Yeah.
It's admirable, but it's not what we require in terms of criteria for admission.
All right, here's another quick hit. What about if I've taken the MCAT once and I wasn't happy with my score, and I decided to take it again? How does your school view multiple MCAT attempts?
We think it is fine for an applicant to seek to improve their MCAT score. I think where we begin to get worried is when it's taken, 4 or 5 attempts on the MCAT, just, frankly speaking, for a student to achieve a certain score. And it's where we ask questions specifically in one of our interviews around preparation for MCAT so that we can understand, what resources we might need to make available for students or what resources students have traditionally utilized in general studying. But 1 or 2 retakes of the MCAT is not problematic for us. We think it's good for students to want to show some improvement on their MCAT if it's not exactly where they want it to be, or if they weren't successful getting into medical school the first time. Right. And we will often advise students, say, hey, here's an area that we think you might want to focus on is the MCAT. And so if we are going to throw that out there, we're okay with you actually taking the advice.
Well, there's something listeners should check out your website, because there's a thing on there where you can sign up if you want some advising.
Yes, absolutely. We do what we consider post-cycle advising. It's just like this forum here. Not all students have access to really good advising. And for students who are really interested in coming here to the UTHSC College of Medicine, we want to make sure that we sort of reduce those barriers for success and matriculation. So our office provides post-cycle advising, typically in the summer months, for students who are interested in strengthening their application, or perhaps they may be on the wait list at that time, and they're like, hey, just in case I don't get in during this cycle, I want to know what are some areas of improvement that you might recommend so that I can begin preparing. Because early preparation is definitely necessary with the way the cycles run.
Okay, good. I'm glad that we brought that up, because that's another unique thing that you have opened offer to advise students if they want to decide they want to reapply to.
It's a huge undertaking for our office, but we're happy to do it.
I can imagine. I guess my last quick question for you when it comes to the admissions piece is, what about gap years? I think we're seeing an increasing trend of students applying not as a senior, but as applying after they graduate. What are your thoughts on those?
Yeah, it's a hot topic for us, right? Many of our students, the majority of our students, don't come directly from undergrad to UTHSC College of Medicine. Many take gap years, and the advice that I typically give is a gap year or 2 is fine, but what's more important to consider is what you're doing in that gap year. For us, we like students to stay connected to some medically related experience. Students might take a year off to get some scribe experience, or the other thing may be for students to want to conduct some research or to finish up a research project. Those things are okay. If it's just a general job, not connected to medicine in any way or to research, it's one of those things that I would, likely say, find something, that you can do in that gap year that's still going to help you in your ultimate goal of becoming a med student and then physician.
Yeah. Yep. So as long as something meaningful, not just taking a break that year and hanging out in your parents' basement or something like that.
None of that.
Yeah. Okay. So kind of cover any general kind of advice for prospective applicants to your school.
I would say get connected with us early on. One of the things, and something that's not on our website just yet, is we launched an inaugural program last year called LEAP, Learning and Engagement for Aspiring Physicians. In our sort of review of our pathway programs, we realized there was a missing link there in how we have outreach to high school students, especially in such a diverse city like Memphis. So our office came up with a program called LEAP, Learning and Engagement for Aspiring Physicians, where we actually work with juniors and seniors in high school to provide a one-day experience on our campus. We did this in collaboration with CHIPS, the Center for Healthcare Improvement and Patient Population, so that we are leveraging opportunities, real opportunities that medical students have and residents have to learn in CHIPS with our high school juniors and seniors who have a strong interest in pursuing a career in medicine. The other half of that day is spent participating in panel discussions where we invite panelists who are faculty and who have served on an admissions committee here or other universities or colleges to talk about the pathway to medical education through admissions and give their best advice for students who are interested in pursuing it as a career. But we also have a panel of community physicians who are practicing here in Memphis so that they can understand that if they were to fast forward time and would want to practice in Memphis, what it's like to practice in Memphis and how they can get connected to resources early on to realize their dream of becoming a physician. We found that it helps for students who are looking for shadowing opportunities. We found that it is one of the things that cements a student's interests, and we're very much looking forward to being able to capture some data through our CRM for admissions on students who participate in this program. So in February, we will have our second edition of this program, and we're really looking forward to it.
Yeah, it sounds like a very inspirational program for those students. Yeah. Yes. Okay. I'm sure I can't wait to see the data. I hope that it's going in the direction you guys hope for, because it sounds like a great undertaking.
Oh, yeah.
All right. So interview day. Are you guys virtual, in person?
We are still virtual, 100% virtual right now. So all candidates who are invited to interview will interview with us via Zoom at this point. But we have a really structured interview day experience that we hope students enjoy.
What can they expect?
Yeah, so we started with an opening session. So they are greeted by members of the Office of Admissions in the College of Medicine. And we roll out the expectations for the day. We provide, really important information that they'll need to take note of for that day. And something that we did starting last cycle, we actually had a local media company come in and record a video where they're able to learn about medical education, both the preclinical and clinical curriculum. They're able to learn about resources like SASE and counseling services. They're able to learn about student affairs, able to learn about the 3-year MD program in a video that we show during that morning session. That way, we can make sure that the people who are the experts in those spaces have some touch point with our applicants on interview day as well. Because it's kind of hard to get everybody to come every single day.
Oh, yeah.
It's our job, right? But it's not everybody else's job, right? So this was a way that we've done that. And then from there, we have 2 interviews. Our students have an academic interview and a non-academic interview. The academic interview is structured in a way where it gives us an opportunity to really understand how a candidate's academic profile aligns with their interest in a career in medicine. So we can ask questions about how they study, how they prepared for the MCAT, what some of their challenges have been related to their academic pursuits. And that interviewer has access to a candidate's grades and scores.
Okay.
The second interview, the interviewer is blinded from any grades or scores of the candidate.
So it's really not about that anymore.
It's not. It's not. It's an opportunity for us to really understand who that candidate is as a person, their motivation for medicine, and experiences that they feel have led them to pursue medicine as a career. There are some ethical scenarios that candidates are taken through as part of that second interview as well. But it really is an opportunity for our candidates to just really not even think about the academic profile. And it's an opportunity for us to just really learn who they are as a person and really assess communication skills and other things that we find valuable in students matriculating to the College of Medicine here. And then if we were in person, our students, we have a group of what we call student ambassadors that work within, my office. But these students will join them during the noon hour of each interview day experience to lead them on a virtual tour of our campus and clinical sites. So again, we took the time to put together a really nice video of our campus and clinical sites, and our students talk through this. So it's not just a play it and just at the end we'll take questions. Our students go into detail about how they have sort of navigated our campus and clinical sites to provide some additional information for our candidates that day. And at the conclusion of that virtual tour of our campus and clinical sites, our students have a question and answer session where they take questions that the students might have related to, or the prospective students might have related to the video, or anything else that they want to know about.
That's nice. That's always nice.
We wrap up the day with a session where we can get a pulse within the Office of Admissions on how the interview day experience went for students. It's where we share final pieces of information, but also provide a link to a survey where students who were interviewing that day can share their feedback with us on what they thought of the overall interview day experience. And then outside of that day, every Thursday night, the Thursday night of your interview week, we make sure there's an opportunity for candidates to connect with our students through a forum where there are no faculty or administrators present whatsoever. So when they get their interview confirmation email, there's a link for them to register for this opportunity. They jump on. We always tell them it's very informal. Just an opportunity to understand the perspective of our current medical students. I always say there are 3 P's related to medical school admissions. It's the process, the pathway, and then the perspective. And I will tell you that the perspective that candidates are most interested in is likely that of current students in those seats. And we want to provide that opportunity for candidates to really understand what it's like. So our students will just join them. It's informal. And answer whatever questions that they have for them at that time. Yeah,
that's great. I think you're right. I think it's what a lot of the prospective students really want to hear about the current users, and can they see themselves here, and what advice do they have? Maybe even reassurance.
We started taking students with us as we hit the recruitment trails, and my reasoning behind doing that was, a prospective student will come up to a booth at a table and they'll talk to me for 3 minutes max, where they get all their questions answered. If we have a student there, they will talk. If we're at a college or university, they will miss the next class to have an engaging conversation with the current medical student. So for our candidates, we want to simulate that as well. So that's kind of how we've done that.
They want to be them. They want to be them so badly. How about, let's see, do you plan on staying virtual next year, future years? You kind of know yet or no?
So we haven't arrived at a decision on that just yet. It's one of the things that we watch the guidance of the National Committee on Admissions and the AAMC's guidance on that to make sure that we kind of follow that. It's kind of been our practice to date. So I think we'll probably arrive at a decision about going back in person or remaining virtual towards the end of the spring semester. We'll tell you that one of the things that we do is still in this virtual environment is for accepted students in the spring. Every other Friday, they have the opportunity to actually visit campus and do
Great.
tour of our campus. So before they make a decision, we think it's important for them to be able to touch and feel our campus. So those tours are in person, as well as second look will be in person as well.
Okay, great. Yeah, that's important to get them on site and for them to, like you said, touch and feel the place and pick up the vibe, and that's very important. One more thing I want to ask you before we wrap up this part and just kind of wind things down, but you accept applicants from out of state.
Yes.
And this is kind of a new initiative, and we were kind of touching on this a little bit before we hit the record button, but tell me a little bit more about this initiative to attract out-of-state applicants.
Yeah. So the way it used to work is that you had to be a Tennessee resident or resident of 8 contiguous states to apply to the College of Medicine. The exception was if you were a child of an alum, you could reside in any of the states. But a couple of years ago, when our executive dean arrived, that was one of his initiatives, was to make medical education at UTHSC available to anyone from any state. So we did that. We expanded. So now you can be a resident of any state and apply to UTHSC. We paired that offering with a one-time reduction in the cost of tuition for out-of-state residents. So we wanted to make sure that, we kind of aided in students' ability to select UTHSC as a possible institution for medical education if they were from a state other than Tennessee. Again, a way that we have tried to tackle reducing the financial burden of medical education. So that's something that our executive dean has been very serious about. And that's just one of the initiatives that we have added to our bag, so to speak.
Mm-hmm. Yeah, that's great. But I guess I think I read 10% of the class can come from out of the state.
Yeah, generally 10%. As a state-supported institution, it's important to us to make sure that we prioritize, Tennessee residents. So generally, about 10% of the class is from out of state. We can admit up to 10%. The benefit of the 3-year MD program is that because it's incremental to the class size, as that program grows, so does the number of out-of-state residents that we're able to accept also. So, yeah.
Oh, wow. If I'm an out-of-state resident, is there a pathway for me to get residency in as a Tennessee resident?
We have found that there have been situations where students have been able to do that. There is a new initiative for the University of Tennessee system as a whole. So if you are a veteran, no matter what state you matriculate from, you will receive in-state tuition. So that's one way. President of the UT system has been very helpful in helping us achieve that. There are other ways that students are granted in-state tuition with very specific situations that we often refer our students to our residency coordinator within our central admissions office to make sure that they are eligible and qualify.
Okay. All right. Cool. Any kind of general tips for interview days at the College of Medicine?
My general tip would be to show up and to be your authentic self. We are looking for candidates who are not so rehearsed, but we want you to be who you are so that we can get a really good picture of who it is that we're interviewing, one, and two, to engage throughout the day. One of the things that I will often lead with is just as much as it's an opportunity for us to know more about the candidate, it's equally an opportunity that candidate has earned to learn more about us as they consider us as a possible institution to matriculate to. So we want students to be engaged during the interview day experience, whether it's in person or virtual, and to make sure that they get their questions answered from us as well.
So bring your questions because you're interviewing us just as much as we're interviewing you.
That's it.
Yep. When you go to admissions committee, then after that portion of the process, how often do you guys put out your acceptances? Is it a rolling thing, or do you do it at certain touch points throughout the cycle?
Yeah, so we have rolling admissions here. And so what that means for us is that as often as we are inviting candidates for interviews, we're also offering acceptances to candidates who have interviewed already. So about every 2 weeks or so, there is an opportunity for us to extend acceptances to candidates who are interviewing.
The medical school is like their dream place. They want to be. Do you want to hear from them, or are you like, we're good, just, hang on kind of thing?
I always encourage applicants on the wait list to submit a letter of interest, because sometimes you're down to the wire and you're really looking for someone who's interested in attending this particular institution. And so when we are able to receive that information from an applicant, it really does help. And we do add that to an applicant's file so that we can review it.
Yeah. Yep. I'm glad I asked, because that's what they want to know. And some schools take them, and some schools, say, yeah, we want to hear if you're out there.
One of the things that we do in terms of updates to an application is that those are generally reserved for candidates who've already been invited for an interview. So let's say you're a candidate who says, I think I was a little bit on the lower side of shadowing opportunities at the time that I submitted my application in June, but here it is, December, and I'm interviewing. And since then I've added, an additional 100 hours of shadowing that I really want them to know about. We do ask that you share that update with us ahead of your interview day so we can make sure it's in your file for your interviewer to see. That's great.
Now, when they just as a kind of a process thing, is that something they upload through like a portal, or is that something they're prompted? You can email it to our office kind of thing. Yeah.
We encourage them to send it directly to our email account, and we're able to just take care of the upload into their file for them.
All right, cool. Dustin, this has been great. Very comprehensive. Is there anything that we didn't touch on as far as maybe what you're looking for, or interview day or admissions committee process that you wanted to mention before we say our goodbyes?
One or two other things that I will mention. Recently had an opportunity to meet with our medical education dean. One of the things that students are really interested in, we talked about Clinica Esperanza earlier, which is a clinic for the Spanish-speaking population here in Memphis, but is adding a Spanish elective that students will be able to take. So we expect that will be available in the upcoming academic year for students. And the other thing that I'd like to note is that we offer an opportunity for students to take a scholars year and step out of the curriculum to do something. Let's say they want to pursue an MBA or do research. So they're able to take time where they're still enrolled here, but just not in heavy, coursework. If
they want to sink their teeth into something more robust beyond what the longitudinal research thing is, they can step away.
Right. Because we do realize that for students who are going into certain specialties, if they have some additional research they've conducted, it really helps them. And so we have a couple students who are doing that right now. So they're just taking a year to do a scholars year and to do research at another institution. And they'll be back in the clinical curriculum next fall. Yeah, great. So flexibility is important to kind of meet everybody's needs. Well, listen, this has been really fun. Thank you. Fun. Yeah, no, I love doing these. I wish I had more time. But this has been really, again, very comprehensive, and I'm glad that we were able to connect and get together to do this. Same here. Thank you so much for the invitation. Oh man. Well, listen, thanks again for coming on, and I'll see you around. No problem. Take care. All right. See you.